Perfect. All right. Well, let's get started. I'm going to go ahead and share my screen with all of you. Let's see. Perfect. Can we all see this okay? All right. Well, again, welcome to Decarcerate Alameda County's annual budget training 101. We're so excited to have y'all here. Just a reminder, if you want to have access to the slides we'll be presenting, you can go to the website below, decarceratealameda.org. And also just a friendly reminder to check us out on Instagram and Twitter as well. And our handles are at the bottom there. So just a little overview of what we'll be covering today. We'll talk about Decarcerate Alameda County and what we do here and what our goals are. We'll talk about what cities are saying they want from Alameda County. We'll talk about this year's budget influencers, both state and federal, and the impacts of COVID, lawsuits, and more. We'll also be going over the Alameda County budget players, the county budget process, what do we know about the budget so far, and how you all can throw down with us and get connected and plugged in. If you have questions, if you could please just type them out in the Zoom chat. We have some folks that will be monitoring that and answering questions when possible. And again, the budget terminology and acronyms are also on our website. That's again, decarceratealameda.org. All right, so we'll go ahead and get started. Again, my name is Cynthia. I use she, her pronouns, and I am an organizer with Decarcerate County, DAC for short. So we have a steering committee that consists of the following groups: 67 Sueños, American Friends Services Committee, Anti-Police Terror Project, Communities United for Restorative Youth Justice, Ella Baker Center for Human Rights, Hayward Community Coalition, Human Impact Partners, Justice Reinvestment Coalition of Alameda County, Moms for Housing, and Restore Oakland. And our goals with Decarcerate Alameda County are we are working to free people from Santa Rita jail. We are demanding that the district attorney, the courts, and the sheriff department decarcerate Santa Rita jail by 50% by 2022. So as of January 2021, there were 2,100 people in Santa Rita jail with a pre-trial population of 94%. We're saying there should be no more than 1,050 people in Santa Rita jail by 2022. We're also asking that we divest from incarceration and policing. So we're asking that the Board of Supervisors defund the sheriff by 50% within a 3 to 5 year span. So as of this fiscal year, the sheriff budget currently sits at $500 million. We're asking that the Board of Supervisors redirects half of that, $250 million, and puts it into life-affirming resources, which would include community-based pretrial, reentry programs, and housing services. So with that said, we're going to move into our Care First, Jail Last resolution, and we'll have our first speaker be joining us.
Thanks so much, Cynthia. My name is John Lindsay Poland. I work for the American Friends Service Committee and with Decarcerate Alameda County. I go by he, him pronouns. And so a lot of what these goals have been focused on in the most recent months is changing the county's policy in order to prioritize the invest part of our goals of moving money out of the jail, out of the sheriff's office, and into particularly behavioral health services for people who are mentally ill or have substance use disorders, and housing. Those are the big needs that we've identified in order to serve people outside the jail before they ever get to crisis, before they ever get to are pushed into the jail, or circumstances lead them there, or racism leads them there. And also when people get out, that there's community-based services because it's less harmful, and also it's more healing, and it prevents people from ending up in jail. So the resolution that passed the Board of Supervisors just last week has these three components. The first is a policy of the county for all county agencies that does exactly what I've just been saying. So prioritizes the whole continuum of care who face mental health illness, and stops the incarceration and reincarceration of people who are being cycled in and out of the jail. The second piece of that is that it has to be based on data, because we've seen that the county does not really even compile a lot of data about unmet needs for people, whether they're in the jail or whether they're in the community, who have mental illness or substance use disorders. And then in kind of an unexpected development, the County Board of Supervisors created or mandated a new task force of 25 people that's interdepartmental. It will be chaired by behavioral health. It will include impacted community members. They also added some police into this committee. Also for service providers, representatives of a number of different areas of service providers over the next 2 years, if you can go to the next slide. So what's the problem that has led us to this? What we began to see 2 or 3 years ago was that over the last 10 to 15 years, the number of people in the county jail has gone down dramatically. It's less than half of what it was in 2008, 2009. And yet, in the same period of time, the sheriff's budget has continued to go up. So that's what you see on the blue line is the sheriff's budget, while the jail population has gone down. This makes no sense at all. And so initially we wanted an audit of the sheriff's budget. But now we are going for the divest and invest framework that we explained earlier. If you can go to the next slide now. So as this has occurred, the very poor mental health services in the jail, but also just the abuses in the jail, the excessive use of solitary confinement, the number of in-custody deaths, the indifference and cruelty seen in the jail, the terrible conditions for health and sanitation and food in the jail, have led to a number of different lawsuits. So one of those lawsuits, the one that is most advanced, is called the Babu lawsuit. And it is basically, it's focused on mental health care in the jail. And the county's response to that has been, okay, we will hire more staff in the jail, more deputies, and more behavioral health clinical staff. The other suits, one from Disability Rights California, the other most recently from the US Department of Justice, focus more on the lack of community-based mental health services that the county has also fallen down and failed on, that again are leading more and more people into the jail, but are also create conditions outside the jail that are really awful for people who have mental illness and their families, and impact the whole community. So those lawsuits are leading the county to put more money, in the jail, supposedly for mental health services inside the jail, but is expanding the jail overall, the infrastructure and staffing in the jail. But also there's this other legal piece that is will lead the county or force the county to invest more in community-based services. So if you can go to the next slide. So here's just a kind of a chronology of what I've described. Last year, a little before this time last year, the supervisors, again, in response to this Babu lawsuit, and a maneuver by the sheriff in the midst of the pandemic, approved in principle an additional $106 million annually for jail staff, most of it for the sheriff, that would be phased in over 3 years. The first year of that was decided in June of last year, was $18 million. Again, about 2/3 of that for sheriff staff in the jail, and another third of that for behavioral health staff in the jail. At that time, the sheriff had vacancies of its positions in the jail. It had 40 funded vacancies. So they weren't even completely staffed in the jail, and the supervisors gave them more money. And so that first installment came then. Now, a year later, in April of this year, the departments made their proposals for the coming fiscal year that starts July 1st, and they upped the ante. So the sheriff proposed $43 million more money for jail staff, 99 more staff in the jail just for the sheriff office, and then $14 million for behavioral health staff, again, in the jail. This is additional increased money. At that time, at the same time, the number of vacancies of the sheriff's office in the jail is 94. So they have a number of funded positions, and the number of vacancies has actually increased. So they can't even staff even all of the money that the supervisors are pushing towards the jail. Now, next month, later this month, the board will vote on the full budget. If you can go to the next slide. So we just want to say something about how some of the sheriff funding works, because a lot of the money, as Tash will detail later, a lot of the money for the sheriff's office and for the jail comes from county revenues that the Board of Supervisors control. A certain amount, so of those 2,100 prisoners at Santa Rita, almost a fifth of them are federal prisoners who are there on a contract with Alameda County, whereby the federal government pays the county $54,000 per person per year. But the actual cost to the county to have someone in Santa Rita jail is more than twice that. It's over $122,000. There are also some prisoners who are, again, being paid for by Monterey County. And then there's other things that the sheriff's office does to get revenue, where they have contracts with different parts of the county, including with AC Transit that runs the public bus system in the county. And they just ratified a contract, a 3-year contract for $9 million a year for deputies to go on board buses. So there's different ways that the sheriff is trying to get revenue, and the jail is a part of that. So with that, I will turn it over to Shruti.
Hi, everyone. I'm Shruti. I'm a DAC member from Dublin, and I'm just going to tell you a little bit about what you should keep in mind in terms of the COVID-19 pandemic as we advocate for the budget this year, and also as we see how the supervisors respond to our advocacy. So we wanted to highlight 2 big impacts of COVID. First of those being the housing crisis. So I think, as many of you know, Alameda County has been struggling with a housing crisis and a homelessness crisis for a long time. If you look at this graph on the left, this is the point-in-time count of homeless folks in our county, and it's been steadily rising even far before the pandemic from 2009 to 2019. And then on the right side of your screen, you'll see some statistics the county administrator pulled on where things stand right now in the midst of the pandemic. Things have gotten a lot worse. These are national statistics, but they reflect the situation in the county as well. Many renters are behind on rent, and the stock of housing is very down. So the county does have a sort of estimate and a plan of how to address our issue with homelessness. And they've even put a dollar amount on that. So they say, in order to take this curve that is slowly bending upwards and bend it downwards in the next 5 years, we need investments of around $820 million. So there's a significant need and a significant need for money over the next 5 years. And that's something we should be asking for, because this is something that directly impacts how many people end up in Santa Rita jail. And then maybe Cynthia, if you can move to the next slide. The other big impact of COVID-19 has been on mental health. I'm sure, as some of you might know, even before the pandemic, it was estimated that around 40% of folks in Santa Rita jail struggle with some sort of mental health issue. And this particularly affected Black folks in the county. They're only around 11% of our county population, but Black folks make up over half of the folks that cycle in and out of the psychiatric care system and the criminal justice care system. So in terms of COVID-19, all of our existing problems in terms of mental health treatment have gotten worse. Across the country, we found that the number of people suffering from anxiety and depressive disorder symptoms has essentially quadrupled. I think this graph sort of demonstrates that. I think it's pretty shocking. And in the county specifically, mental health providers have told us that there are increased rates of suicide attempts, substance abuse, and domestic violence. And this has really impacted children in particular. Oakland Children's Hospital has reported that they saw double the suicide attempts in 2020 that they saw in 2019. And then additionally, among the people we saw suicide attempts from, Black youth were much more affected. They were twice as likely to have a suicide attempt as white youth. So just on the whole, I think it's worth thinking about. The county has been really impacted by a lack of mental health care and a lack of housing prior to the pandemic, and the pandemic has really made that worse and makes the need for us to invest in those life-affirming resources much more urgent.
Thank you, Sruthi. And
awesome.
Hang on. Thank you. Go ahead, Tash.
Cool. Yeah, so now we're gonna go into sharing what we do know about the budget so far this year. There's a lot more information that that still needs to be shared. So what we're gonna be sharing with you is a bit incomplete, and kind of some of that is based on last year, right? But we're holding this training early in June to arm you with the tools to engage in this moment so that we can build power and fight to get our people free, and also fight to get the Care First resolution actually funded, right? So before we go into the details, I just want to say that a budget our county budget, and any public budget is a moral document. At a fundamental level, the budget expresses what our county's values and priorities are. And so whatever dollars that are allocated in the county budget are really the things that kind of help move these policy ideas that we're generating, like Care First, into a concept of reality. Next slide. So who are the budget players? The biggest budget players in the game are us. We are taxpayers. We create the budget, and we have a right to have a say over what the money that we put into the budget goes to. So I just want to say that we have the most power in this process. We foot all of these people's salaries and their department's budgets, and we have the power to vote them in and vote them out. And so it's really important that we engage at all of those levels. Next slide. So the people that we vote in are these 5 Board of County Supervisors. They're all elected officials. You can go check out that link. Someone will put it in the chat if you don't know who your Board of Supervisor is. But we have, in District 1, we have Supervisor Halbert, who represents East County. That's like Dublin, where the jail is, Pleasanton. We have Richard Valle, who represents South County. That's Hayward, Newark, Union City. Supervisor Chan, who represents Oakland, from Fruitvale to parts of San Leandro to areas around the lake. We have Nate Miley, who represents Deep East Oakland, Pleasanton, Ashland, Cherryland, a number of unincorporated areas of the county. And then we have Supervisor Carson, who represents North Oakland, West Oakland, and Berkeley. I may have missed a few spots, but those are just kind of like the regional cities that folks are from. And then we don't want to forget Susan Miranishi. She is really the woman who holds the purse strings to the county. She is the county administrator. She runs an office called the CAO's office. This is a really great time to also check out that budget terminology sheet that we linked, because it has a lot of the breakdowns of this. She's an appointed person. She's not elected. But when it comes to budget decisions, she can also be the sixth vote on the Board of Supervisors. So she's incredibly powerful. She's the highest paid county executive in the state. And I really urge you to look into her. And so this list is a list of county departments. And this is how they kind of categorize them. And so we have public protections. We're interested in divesting from the sheriff, from probation, who oversees youth justice, from the DA, who sentences people and sends people to jail and prison. And we're invested in supporting the departments that really build out the life-affirming resources folks need in order to prevent and divert folks from being incarcerated. And so that's healthcare, behavioral health and public health live under healthcare, social services, and the community development agency is the agency that works on housing. Next slide. So something to also think about as we are getting to know all these players is how power is distributed, right? So in the county, we elect the sheriff and the district attorney, as well as the Board of Supervisors. So they have a lot more power than folks like the public defender and these appointed social service, healthcare service, behavioral health agency directors, right? So it's important to kind of think about, to be thinking about that. And so with that power dynamic, sometimes the Board of Supervisors can be in a place where they say, you know, we can't tell the sheriff or the DA what to do because they're an elected official, whereas we can hire and fire these appointed people, right? Next slide. All right, so this is the budget process. So in April and May, the county administrator's office, so that's Susan, starts doing some early budget presentations. And I really urge you guys to go to the Alameda County Open Budget website, where you can kind of check all that stuff out if you really want to get in the weeds and nerd out over this stuff. But she kind of starts projecting how much money is coming in, how much money there is. Then they start identifying the funding gaps. What's happening right now is they're assessing, okay, this is what the governor's budget is presenting. So now they're estimating how much state and federal aid that they may be able to get from other places, because the county budget is made up of many different funding sources. In mid-June is really when the CAO begins submitting the proposed budget to the Board of Supervisors. So in a matter of weeks, we're going to be reaching out to you all to mobilize with us to a number of meetings. And that's where departments and the county administrators really presenting what these budget numbers are. Then the last 10 days of June is really when there's tons of budget hearings where budget negotiations happen. And then because the fiscal year starts July 1st, the county has to adopt their final budget by June 30th. Next slide. So budget financing. If you want to know if you can spend the money, you have to go upstream to find where the money comes from, right? So as organizers who are fighting for budget reinvestment, we actually have to go up and have a sense of how much money the county actually has to be working with. And so in these following slides, we're going to talk about how money is structured in the county and how that determines what you can spend that money on. And so last year, the county's general fund had $3.14 billion. Of that $3.14 billion, the discretionary revenue that the county had was about 25% of that. So it's $798 million, nearly $800 million. And what discretionary revenue is that it's money that doesn't have restrictions. It doesn't have any strings tied to it. And so what the county supervisors can do with that money is kind of really use that funding to fund their priorities, right? And so we'll go to the next slide. So what is discretionary revenue? Where does it come from? Well, a bulk of the majority of it comes from property tax. About 17 cents of every dollar of each taxpayer in the county goes to, of that property tax goes back to Alameda County, right? So that totals last year to $484 million. And then discretionary revenue also includes vehicle license fees, sales use taxes, and other revenue that the county can incur by like charging for services. Next slide. And so this slide is really important, right? So, you know, going back to budgets being a moral document, being indicative of where our priorities are. Last year, the county decided to fund about 45% of this unrestricted funding to the Public Protections Department. So 45% of that $800 million, about 9% went to public assistance, which includes social services, and only 17% went to healthcare. Right, so we're trying to upset this setup here. Next slide. This is a graph that kind of gives you a sense of the net county cost. And so the net county cost is basically it's the term that's used for what's allocated to departments using discretionary revenue. And so this chart is a sample of what the percent of what net county cost makes up for each department, right? So the thing to note here is that cop budgets, so sheriff's budgets, DA's budgets, eat a giant, oh, sorry, I think the slide just disappeared. Thank you. So the thing to note here is that net county cost is that cops eat a big chunk of the discretionary budget. This says something about where the county's priorities are and how state and federal funding programs don't actually support policing and jailing, right? Whereas every dollar that's spent in healthcare and housing can be leveraged to the state and federal government to get $8 in return. So, you know, it's not just what's needed funding healthcare and housing, but it's also it's also the fiscally responsible thing to do. And with that, I'm gonna pass it to John.
Thanks, Tash. So where we are now in the budget process is that these departments, all the county departments, have submitted their budgets. And when they figure out, when the county administrator figures out how much revenue is available, there's a gap. Every year, there's more money that the departments are proposing to spend than the county has available. Again, we're talking about the discretionary revenue and the net county costs. And this shows over a 20-something year period, going up to the pandemic year last year, what the gap was each year between what was requested and what was available for the county budget. And you can see that last year with that orange bar, that there was an enormous amount, a historically high amount, because of the pandemic, because the economy essentially shut down for a number of months. If you can go to the next slide. So then what happens is that the unspent money from the previous year is often used in order to make up that gap. There are other ways of making up that gap. They can try and identify new revenues, or they can cut expenditures. But every department usually has some unspent money. They didn't fill vacancies, programs didn't get off the ground. So that's what happened last year. There were actually two different phases last year in which that what are these so-called fiscal management rewards were used. One thing that's important to note is that last year, when the new money that's being proposed for the jail has not identified a revenue source. So it's unclear where exactly that money is going to come from. New money going to the sheriff and new money going to behavioral health. Last year, the new money going to behavioral health staff in the jail came out of those savings from the previous year. This year, behavioral health doesn't have any unspent money because of the pandemic. So it's unclear exactly where the jail expenses are going to come from. And I will now pass it on to Heather.
Hey, hi, I'm Heather. Heather Bromfield. I am a DAC member, and my professional work is in the city planning field. So I'm going to talk a little bit about what cities in Alameda County are saying, what they saying they want from the county. Oakland, Berkeley, and a handful of other cities are starting these processes to re-envision public safety and policing. This is coming on the heels of years of advocacy by groups like the Anti-Police Terror Project, and especially last year in the wake of George Floyd's murder. So cities are beginning to ask, how we should prioritize services from that keep people from coming into contact with police and the criminal justice system. It involves discussions about the root causes of why people end up coming into contact with the police and the criminal justice system. So for example, why are people ending up in homeless encampments that cities are then deploying police officers to help evict, right? So instead of policing homeless encampments, how do we ensure there is adequate housing for everyone? So the two big questions that are being asked are, what calls are the police currently responding to? Who might be better responders to these calls? What programs and services can be provided to address the issues that are upstream of policing? All of these questions involve reallocating resources. The answers involve reallocating resources that are currently spent on policing to other departments and services at the city level, but they ideally also involve a reallocation of resources at the county level. And that's because two of the many areas that keep coming up as something to intervene in are mental health and homelessness. And those two areas have a big bearing on the county. They're influenced by county action or inaction. So next slide. Thanks. As I kind of just alluded to, mental health and homelessness funding and the programs and services are really tied to the county. For example, Medi-Cal funding for mental health, it gets delivered through the county. Non-police responses for mental health crises, it is in part a county responsibility. There's an asterisk because Berkeley and Oakland are both investigating or creating programs to have mental health response be done by other entities as well. But on top of that, affordable housing funding, this touches on every level of government, city, county, and state. And on top of that, homelessness programs and services, it's the same thing, and it touches on every level of government. So the big takeaway is that while cities have some authority over allocating or funding the development of programs and services, getting the county on board is really critical and ensures that all of the responsible agencies and departments that touch on these issue areas are working in concert with each other. They're collaborating, and it's just important to remember that cities are limited in the scope of their authority, even if all of these discussions are happening at the city level. One other thing to know, just in terms of the city and county programs for mental health care crisis response, is that they, for the most part, they involve law enforcement presence for the time being still, and they're also really underfunded. So if we don't fund them, it means that most of the calls are going to continue getting routed through police. We can do next slide. And so just to give a rundown of the cities that are engaged in these conversations, Oakland is the furthest along in its process. Starting last fall and ending in February, there was a task force that was convened to issue recommendations to City Council. There are many, many recommendations, but one of them was specifically around advocating to the county for behavioral health resources and to reduce and limit presence of law enforcement in crisis response for mental and behavioral health. Berkeley is similarly currently investigating a non-law enforcement crisis response program. And just for folks who live in all of these other cities, Dublin, Livermore, Fremont, Hayward, San Leandro, just know that there are processes going on in each of these cities, and they're still early on, but just keep an eye out, and there's an opportunity to get involved. And I will now pass it on to Megan.
Thanks, Heather. My name is Megan Schwartz. I use the pronouns she and her, and I'm going to talk a little bit about how the state budget impacts the county. And as you can see from this graph, this is from last year's budget, 2020 to 2021 for Alameda County. The state of California's fortunes have a large impact on the county, right? Last year, over 37% of Alameda County's funding came from the state. Next slide, please. You've probably heard a little bit about this. The state of California, despite predicting the opposite, is now experiencing a large budget surplus. You probably saw the lottery for people getting vaccinated. Well, this has a lot of other impacts as well, right? California has projected a surplus of over $75 billion. Additionally, there's a great deal of federal funding coming our way. And the governor has prioritized spending on a number of areas that would really benefit our county. The areas that, Heather just talked about where we're deficient, right? So housing, money to fight homelessness, health and human services, including behavioral health care, which is comprised of mental health care and substance use treatment. Can we get to the next slide, please? So Governor Newsom's budget has targeted funding towards housing and homelessness. This is a particular focus of the state budget that could really impact Alameda County. So there's almost $12 billion allocated for housing and homelessness over the next 2 years. Additionally, there's an enormous amount of money going towards health and human services, over 200 billion, but there's a particular focus that the budget has highlighted for behavioral health care for those under 25. There's $1 billion going to this program in the next year. And I just wanted to read this statement in the governor's budget because I think it really clarifies what the goal is. Governor states in his budget, the goal is to transform California's behavioral health system for children and youth into a world-class, innovative, and prevention-focused system where all children and youth are routinely screened, supported, and served for emerging and existing behavioral health needs. So it's a real focus on preventative care. And I think this is something that our county has been particularly poor at. We've claimed that we don't have the resources to do this, but I think as you can see, the state is providing that funding, billions of dollars of funding that our county can take advantage of. Next slide, please. I'll just close by saying that there are millions of dollars of state aid available that can be accessed through these programs. And these are the services that the county really needs, but we're not set up to take advantage of these programs with continual cuts to our county mental health infrastructure and an over-reliance on policing and incarceration. And I'll pass it over to Shruti to talk about federal funding. Thank you.
Hello again. I'm just going to follow up on what Megan said about state funding with the other, I think, major source of funding that is often tied to programs, which is aid from the federal government. It's not quite as much as state aid, but it's still very significant, almost 15% of that $3.5 billion that the county spends in a year. Next slide, please. So that $519 million number in federal aid is from the previous fiscal year. We are still waiting on President Biden's federal budget to know how federal spending is going to look for our county in this upcoming fiscal year, but President Biden has proposed a budget already, and we just wanted to highlight for you some of the increases in money that we want to see the county, that we'd like to see the county take advantage of. So one of those increases is 23.5% overall increase in money going to the Health and Human Services Department, including a new CDC program for preventing community-based violence. So, or community-based violence prevention. I think many of you will see statements from our Alameda County Sheriff saying crime rates have gone up, we need more money for police, but there's money available to address this problem using evidence-based solutions that aren't based in more violence. And then also worth noting is that there's going to be 2 times as much money for this program called the Community-Based Mental Health Services Block Grant Program. So that's what we want to see as DAC members, community-based mental health services. So we want to make sure that our county has staff in place to apply for that money, take advantage of it, and make sure we're spending this available money on community-based mental health services in our county. Next slide, please. And then I think something really important to look out for is, I'm sure many of you know that the Congress has passed the American Rescue Plan to address the impacts of COVID-19 by doing a variety of things, but one of those things is sending aid to state governments, county governments, and local city governments. So if you live in any Alameda County city with more than 50,000 people, your city has probably already received some of this American Rescue Plan money. And we wanted to highlight that the county is going to get a significant influx of cash here, $163.5 million this year, and then the same amount next year. So there's a variety of uses that acknowledge that COVID-19 has affected people's mental health a lot. And that includes more behavioral health care, substance abuse disorder treatment, supportive housing, and primary care. But it can also be used to pay the police. The supervisors have discretion over this money. It's kind of more similar, I would say, to general fund money than grant money. So I think we should all look out for this as an opportunity to look out and see how the supervisors are going to spend this money and ask them to use it in ways that are just and equitable and invest in our community, invest in solutions that will address these existing problems that have been made worse instead of investing further in policing and incarceration.
So Shruti and Megan have really laid out how there's some unprecedented opportunities for using federal and state funds available in order to address the needs within the county: housing, mental health, substance use disorder treatment, and so on. And so we wanted to just make a comparison. We want to pay the full amount. We don't want to pay for things that meet people's needs. But it's also true that incarceration is a very expensive way of harming people. So this is just a comparison. The first set of figures here are once a program is established, like the jail or like other types of care in the county. It costs more than $122,000 per person in the jail, mostly for staffing, compared to almost about half that amount in a subacute inpatient care facility like Villa Fairmont, and even less for people who can be served by permanent supportive housing or by full service partnerships, which are more about coordinating care for people outside facilities. Now, the county behavioral health department has also proposed establishing some new facilities or beds or expanding facilities. And those are more costly because you're setting them up. The annual cost of those would also need to be calculated, but this is just to give you an idea of to get going certain types of treatment for people who need different types of care. If you can go to the next slide. What are some of the ways that we're working on this? We are supporting a reopening of the decision made last year to dedicate $106 million more per year for jail staffing. There's a proposal from Supervisor Richard Valle to say any new funding, there should be a 1-for-1, an equal amount of community-based services funded as any dollar going into mental health care in the jail, which would, if you apply that to the $106 million, it would mean moving $53 million out of that into community-based services, knowing that neither behavioral health nor the sheriff's office has yet absorbed that full $106 million. We're also supporting a proposal by community-based organizations that are providers to restore services and change the way contracts are done so that providers can be compensated in a rational way for the services that they provide, and also to adjust to the changes in the minimum wage. And then we also are supporting the proposal from behavioral health for increased programs and services. As noted by Shruti and Megan, we support the influx of state and federal funds to ramp up these services. If they're spread out over several years, it could be done in a way that is sustainable, and potentially even to use county reserves, especially for things that are one-off costs, like capital costs, building hospital beds, and so on. Next slide. How do we work on this? And this is something, we're about to break into breakout groups. We need to be part of the conversation. We need to be in the media. We need to change the narrative. People can write, people can work in social media, work in your networks. It's really important that the supervisors understand what are our budget priorities and how do we want them to reflect those priorities this month, this year, and not wait for another year. In supervisor meetings, you can make public comment. You don't even have to wait for the budget hearings if you want to make a comment for something that is not on the agenda. And then we want to reach out. We know that there's a lot of support for for this work in North County, in Oakland and Berkeley. I know that there's some people in South County and other parts of the county in this training, but it's really important that geographically, but also in different communities, in our workplaces, in our faith communities, in our neighborhoods, in the different people that we hang out with, in our professional groups, in unions, that we are able to grow this movement and have people weigh in on behalf of their organized groups. And of course, a lot of this requires building relationships, talking with people, and not just making it a one-off. If it needs it, then we will also, be taking direct action. There's more opening up in the county, so it's more feasible to go out and do in-person things, which we may end up doing as well. With that, I will turn it over to Cynthia.
Thank you, John. Yeah, so we're gonna go into breakout rooms here in just a minute, but just a few things to highlight. How can you all down with us? Like, how can you get connected with Decarcerate Alameda County and work on these goals that we're trying to reach? So just a few examples is joining us, join Decarcerate Alameda County, and also joining one of our work groups. So you can contact me directly. I have my email here. I will also paste my email into the chat for folks. It's just Cynthia@restoreoakland.org. If you have any questions or you're interested in joining, please let me know. Again, reach out to us via Instagram or Twitter. Both of our handles are also on this slide. Again, you have access to this from our website at decarceratealameda.org. I've also put in our email. And then we do have an interest form that we would love if all of you could fill out. It should take just a couple minutes, about some areas that you might be interested specifically in with Decarcerate Alameda County. So we will also put that in the chat as well. All right. I really hope that those breakout rooms were helpful for y'all. And let me share screen with you again. It looks like we got a lot of really great feedback from everybody that I know I'll be really excited to go through. And we're coming up to the end of our presentation. So just a couple of reminders that please get involved and plug in with DAC. Again, we have our Instagram, our Twitter, our website. And then if we can get someone to paste in that Google form one more time, if y'all can take just a couple minutes to fill that out, would be super helpful. But seriously, like, thank you to everybody who came out, especially on a Saturday. It means so much to us to have all of you here to support us. A huge shout out to our budget ledge group that helped put this together, our budget training group that worked really hard on this. All of our speakers who really kicked ass today and like did really well, like super appreciate all of you. All the folks in the back end doing tech support, Jose from Ella Baker Center for navigating this Zoom, because I know I couldn't do that. I was confused myself, even just in the breakout room. So, and it especially big shout out to our interpreters today, Wei Quinn and Alexis, who did that on their own. And I don't know if y'all know how difficult interpretation can be. For an hour and a half, just one person, no breaks. So like huge shout out to both of you for that. And I'm really excited to get y'all plugged in and learn more. We'll be sharing some information on our website from today. We'll be sharing this event also on our website once we finish editing, and also on our YouTube channel, I believe, as well. Yes, Paula from the note taking will be posting some of the bigger outtakes from the different working groups for folks to look over. And if anyone has questions again or anything at all, please don't hesitate to reach out. I'm gonna again put my email in the chat. But other than that, I'm not sure if any of our other presenters have anything they'd like to share, aside from like, thank you everybody so much. All right. Well, other than that, we'll see hopefully all of you later at some point. Have a good weekend. Enjoy the heat. Have some fun with your family. And yeah, thanks everyone.